Hospitals are cornerstones of their communities, serving as principal access points to care for nearly 60 million people, or 20% of Americans who live in rural areas. Despite their importance, rural hospitals continuously confront a multitude of challenges that threaten their ability to ensure local access to care. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer at AHA, and your host. Earlier this year, AHA published a report titled Challenges Facing Rural Communities and the Roadmap to Ensure Local Access and High-Quality Affordable Care. The report outlined specific legislative and policy recommendations to address the challenges facing rural communities. These include developing new models of care, expanding access to telehealth services, cutting red tape, and fair and adequate reimbursement that covers the cost of care. John Suplett, Senior Director for Rural Health Services at AHA, is on hand to discuss the report and its findings.
In this podcast, we'll explore the narrative of the Rural Report and its purpose as a call to action for rural health providers and advocates alike. Joining me today are two experts who are immersed in the policies of politics of rural health care. They are instrumental in the AHA's efforts to achieve equity for healthcare providers and protection for vulnerable rural communities. Erica Rogan completed a PhD program in health policy at Yale University's School of Public Health, and in 2017 was named an Aspen Ideas Festival Spotlight Health Scholar for her academic and professional accomplishments. She is now Senior Associate Director of Payment Policy at the American Hospital Association. Welcome, Erica.
Thanks for having me, John.
We are also joined by Travis Roby, who earned his law degree from the University of Maryland and has over 10 years' experience working on Capitol Hill, most recently as the Chief of Staff for Congressman Ron Kind. He is now Senior Associate Director for Federal Relations at the American Hospital Association. Welcome, Travis.
Glad to be here, John. Thanks.
Erica, you authored the Rural Report. What was the motivation for this study?
Well, first and foremost, there's been a concerning trend of rural hospitals shutting their doors, which can lead to serious issues accessing health care. As of this month, in June 2019, 107 rural hospitals have closed since 2010, including 10 hospitals in just this year alone. In addition, a recent GAO report also found that between 2013 and 2017, more than twice the number of hospitals closed than in the previous 5-year period, and this indicates that the trend in closures is worsening over time. Several of these closures, too, have resulted in a complete loss of local access to care, meaning patients in those areas often have to travel long distances when they seek medical attention.
Those are some frightening numbers.
Indeed. And with this as the impetus, we wanted to develop a document that describes the context for these hospitals, what they're up against, and what might be contributing to closures we've been seeing. The AHA Rural Report provides an updated narrative of the challenges facing rural hospitals and their communities, as well as some recommendations for policy action. And this report is a powerful overview of the persistent, recent, and emergent challenges facing rural health care.
Erica, can you walk us through in more detail some of the biggest challenges rural providers are facing today?
Absolutely, I'd be glad to. Rural hospitals continuously confront a host of challenges that threaten their ability to ensure local access to care. Some of these challenges, such as low patient volume and a heavy reliance on public payer programs, have persisted for many years, while others, such as increased regulatory burden and shifts from inpatient to outpatient care, are more recent. As these challenges intensify and compound each other, many rural hospitals, especially those with very limited resources, face difficult decisions, including cutting back on services or even closing their doors.
So these challenges affect both the present day and the future for these providers.
Yes, exactly. And not only do the current challenges impair hospitals, but the issues of today can really hinder rural hospitals' preparedness for the issues of tomorrow, what we consider to be emergent challenges. For example, an emergent problem such as the opioid crisis or a natural disaster requires organizational agility and capacity to shift focus and resources in an efficient manner. And that can simply be hard to do when a hospital is already trying to tackle long-standing challenges and manage limited funding and staff.
Erica, what do you hope is achieved through this report?
The fundamental purpose of the Rural Report is to help clarify what issues are at the forefront for rural communities and to prioritize what policy actions are needed to be taken. My hope is that rural hospitals and health systems use this report to help spark conversations with community stakeholders and policymakers to address some of their most pressing issues and brainstorm new creative solutions. We know that the healthcare landscape today is changing rapidly, and it's important that rural providers are a part of that change. But with less volume, fewer resources, and myriad challenges with recruitment and retention, rural healthcare organizations struggle to stay competitive. We hope that this report serves as a roadmap to spurring innovative ideas, policy change, new payment models, and creative community partnerships to meet patients where they are.
That's a fantastic vision. Travis, Erica has explained that the Rural Report focuses on the challenges that face rural hospitals and how the AHA is positioning its advocacy efforts to prepare us with a roadmap for the future. Tell us, what does that advocacy plan look like?
Of course. Well, the AHA Rural Advocacy Agenda is our response to this call to action. It serves as a companion document, and the language aligns with how recommendations are organized in the report. It's organized by the need for updated federal policies and the need for new investments in rural communities. We want to ensure that the advocacy agenda complements the rural report so that rural health leaders can use them together to get involved in our advocacy efforts. So in light of the ongoing challenges and those ahead, the AHA believes that federal policies need to be updated and new investments made in order for rural communities to thrive in a healthcare system of the 21st century. So to this end, the AHA is working to advance policy priorities across several key areas for rural health.
What are the priorities of the AHA agenda?
Well, we identify 6 priorities in our advocacy agenda for rural hospitals. First, ensuring fair and adequate reimbursement. Second, supporting new models of care. Third, bolstering the workforce. Fourth, removing red tape. Fifth, supporting telehealth and health information technology. And finally, reining in prescription drug prices and support for the 340B program.
Have you had any traction with Congress in a way that addresses the challenges outlined in the Rural Report?
Yes, I'm pleased to be able to report that we've had some good successes so far this Congress. Just before the 4th of July congressional recess, the House Ways and Means Committee passed a package of bills that included a number of our rural priorities. First, the package included a provision to extend the enforcement moratorium on direct supervision requirements for outpatient therapeutic services that are provided in critical access and small rural hospitals. Then the package added telepsychiatry to the list of Medicare-covered telehealth services and added the patient's home as an eligible originating site for those services. And finally, the committee passed the Opioid Workforce Act, which is H.R. 3414, which is AHA-supported legislation that would add 1,000 Medicare-funded training positions in hospitals with approved residency programs in addiction medicine, addiction psychiatry, or pain management. And this legislation, we think, can play a really important role in helping to address the opioid epidemic, which is obviously impacting communities across the country, but has hit rural areas especially hard. Now, in addition to that recent Ways and Means Committee action, we've worked with members of Congress to introduce legislation on a wide range of our priorities. That includes bills on meeting workforce challenges by extending and expanding the Conrad State 30 program, that's S948 and HR 2895. Also, HR 1502 would allow physician assistants to receive direct payments in underserved communities. S348 and HR 1763, the Resident Physician Shortage Reduction Act, would create 15,000 new residency slots, including priority for rural programs. And then HRSA's support for rural residency planning and development and CRNA training also came out recently. And then in terms of removing red tape, We've got legislation in the House and Senate to repeal Medicare's 96-hour rule for critical access hospitals. That's H.R. 1041 and S. 586. And then the legislation S. 895 and H.R. 3431 would extend the enforcement moratorium on direct supervision and outpatient therapeutic services. And that's what I just mentioned earlier, passed the Ways and Means Committee in their recent markup. And we're hoping for floor action in the near term on that bill in the House.
And I would also add our continued scrutiny of star ratings, co-location and shared space regulations, as well as our support of 340B, broadband, and telehealth in addition to other policy priorities.
And we continue to look at new payment and delivery system models, such as the Rural Emergency Medical Center and global budgets.
That's really an impressive list of accomplishments. But what about the field? What kind of responses have we seen from them to this call to action?
Rural hospitals are nothing if not resourceful, and many have been creatively problem-solving for years. We see case examples where rural hospitals are exploring numerous strategies to preserve their scarce resources and increase access to health care. And these include things like team-based care, models such as patient-centered medical homes, affiliations with healthcare networks, telehealth services, and partnerships with other healthcare facilities and organizations.
Travis, what can we expect to see in terms of congressional activity related to rural health care in the next few months? And what are our biggest opportunities and fights ahead?
Now that the Ways and Means Committee has passed a package that includes rural provisions, it can come to the House floor for a vote. They haven't set a timeline for considering the bills yet that were moved out of committee recently, but we're encouraging them to bring them to the floor as soon as possible. Now, on the Senate side, we've had ongoing conversations with the Finance Committee about a rural package. Chuck Grassley from Iowa is chairman of the Finance Committee, and he's a longtime champion for rural health. He has a year and a half left before he's term limited as chairman of the committee, and he very much wants to see a rural package move forward in that time. We've been talking with the staff about all of our rural priorities that I mentioned earlier in the podcast, and we're hopeful that a robust rural package is going to be able to move sometime this fall in the Senate.
Great. Sounds like a busy few weeks and months ahead. So what are the next steps to this call to action?
Well, without resource support and targeted policies for rural communities, many hospitals in these areas will not be able to effectively tackle new or existing challenges. Now, to be sure, some rural providers have been able to build capacity, leverage opportunities to innovate, and affiliate themselves, in some cases, with strategic partners as the healthcare environment is evolving. But for others, the continued cumulative burden of those persistent, recent, and emergent challenges will threaten their ability to provide care for their communities. Recently, we visited Winona Health in Winona, Minnesota, and Western Wisconsin Health in Baldwin, Wisconsin, and I was very encouraged by what I saw. Both hospitals are strategizing and implementing new ideas in care coordination, public health, and advanced payment models. It was really great to see just how innovative they are and how they're working to serve their patients so well.
Although rural hospitals have long faced unique challenges that can complicate health improvement efforts, more recent and emergent challenges are worsening their financial instability and potentially the economic health of their communities. Individually, certainly these challenges are complex, but taken together, they're immense, and they require policymakers, stakeholders, and communities to work together to innovate and to embrace value-based approaches to improving healthcare in rural communities. And the federal government really needs to play a principal role here by updating policies and investing new resources in rural communities. Now more than ever, we need Congress to pay attention and to take action to save local access to high-quality, affordable care in rural communities.
Well, this was a great insight into the Rural Report and the narrative of the challenges facing rural hospitals and communities, as well as the AHA advocacy and the field's response to this call to action. Thanks for listening, and thanks to Erica Rogan and Travis Roby for their time and expertise. If you want to learn more about the work that the AHA is doing to improve access to care in rural communities, visit us at www.aha.org. I'm John Supplett, and this has been Advancing Health, a podcast brought to you by the American Hospital Association.